Okay, welcome everybody. This is the information session for those interested in pursuing a graduate Master of Public Health degree in Applied Epidemiology. We do have guests visiting this session from all parts of the world, so I thank you for joining us, especially those where it might be very late at night or very early in the morning, or even during your work hours. I appreciate it. I anticipate this presentation will be around 30 to 40 minutes long, so I'll stay afterwards on Zoom if you have any specific questions that you might want answered. My name is Lawrence Chu. I am the graduate coordinator for the MPH in Applied Epidemiology program at California State University, Northridge, or CSUN. I have been a professor at CSUN for the past 20 years, and I graduated from UCLA with my doctoral degree in epidemiology, my master's in public health, and my Master of Science in biostatistics. Before I was a professor at CSUN, I worked as an injury prevention epidemiologist for the Centers for Disease Control and Prevention, researching all kinds of injuries related to motor vehicle crashes, falls, drownings, homicides, domestic violence. My research interests today, however, they center more around health disparities among the different racial ethnic groups for chronic diseases, such as diabetes and cardiovascular disease. Our agenda for today is as follows. I will briefly talk about public health, what it is, and how epidemiology is a part of this field. Then I'll get into some career statistics and projections on the job market for epidemiologists, and follow up with our specific graduate program in applied epidemiology, including how to apply to our program, important dates to remember, and I'll end the session with some of the most frequently asked questions I get from prospective students every year. So what is public health? Many of you already have a pretty good idea what public health is since you have an interest in joining today's session. Public health promotes and protects the health of all people and their communities. It's a science-based, evidence-backed field that strives to give everyone a safe place to live, to learn, to work, to play. And it's important because public health improves our quality of life. It reduces human suffering. It saves resources. It allows us to live our everyday lives. The world has come to understand public health very well during the past few years of the COVID pandemic. As professionals in this field, we're tasked to track COVID outbreaks, we vaccinated populations, and we communicated preventative strategies to communities to protect the population from this virus. Now, public health is very different from healthcare in that the healthcare industry, that is doctors, nurses, clinicians, they treat people who are sick, whereas public health professionals prevent people from getting sick or injured in the first place. Public health also focuses on entire populations, while healthcare focuses on individual patients. There are generally 5 areas of public health that have their own unique fingerprint on the field. They are biostatistics, epidemiology, environmental health sciences, health policy and administration, and community health education. In our public health program here at CSUN, we offer 3 degree options at the graduate level. We offer MPH in applied epidemiology, and we also offer the MPH in community health education in 2 different options, which are an on-campus option as well as an online distance learning option. So let's talk about epidemiology for a bit and why it is a lucrative career. Epidemiologists are public health professionals who investigate patterns and causes of disease and injury in communities and populations. They generally work in offices and laboratories, usually at health departments for state and local governments, in hospitals, at universities, even in private sectors like biopharmaceutical companies. The entry-level requirement for most of these positions is a master's degree in public health or a related field, and some even complete a doctoral degree in epidemiology or medicine. As of May 2022, the median annual salary for epidemiologists was $78,520. That means half of all the epidemiologists made more than this salary amount and half made less than this amount. The job outlook for employment of epidemiologists is projected to grow 27% from 2022 to 2032, much faster than the average for all occupations. Over the next decade, approximately 800 job openings for epidemiologists are projected each year. Many of these job openings are expected to result from the need to replace workers who are retiring from the workforce. And on the slide are some examples of epidemiology careers that include infection control epidemiologists, also known as hospital epidemiologists. And these are those who create and implement policies that control disease and limit the spread of infection in healthcare settings. Medical epidemiologists, these are people who might monitor disease outbreaks and study the clinical pathology and research potential cures for chronic and acute illnesses. We have field epidemiologists who intervene on the ground level in communities with acute public health crises, such as, for example, a contaminated water supply in the community, or maybe a foodborne outbreak. And then we also have veterinary epidemiologists that studies patterns of disease spread among zoonotic animal species. In 2022, the top median salaries for epidemiologists were distributed by the following industries. Scientific research and development services paid the highest at $103,000, and these are generally private sector companies such as biopharmaceutical companies that hire epidemiologists to collaborate on clinical trials for experimental drug treatments. Hospitals had an annual median salary of about $95,000, where they hire infection control epidemiologists to limit the spread of infectious diseases in medical care settings. Colleges, universities, and professional schools, they hire epidemiologists to disseminate the knowledge and skills to prospective students at a median annual salary of around $80,000. And local and state government departments, they are one of the largest employers of epidemiologists to conduct field epidemiology, that is, to collect data in the community, implement prevention and intervention campaigns, and also look after the safety and well-being of residents in their area. Some of the key qualities that make a good epidemiologist include the following on this slide. Now, if you already have some of these qualities, then you would make a great epidemiologist. However, even if you don't possess any of these qualities or even some of these qualities, our program is designed to help introduce, build upon, and really strengthen these skills so that you will be confident and competent in the field when you graduate. Communication skills are important. Epidemiologists use communication skills through speaking and writing to inform officials and the public, such as for community outreach activities to explain the health risks of smoking. They also must be able to convey information effectively to other health workers. Epidemiologists must also possess good critical thinking skills to be able to consider a variety of resources in responding to public health problems or health-related emergencies. Epidemiologists have to analyze data when reviewing results from studies and surveys. So having strong math and statistical skills is important in this regard. Additionally, understanding how to manage and use large health databases and statistical computer programs is critical. Epidemiologists may need to direct staff and assign work in research or investigating a disease. So having good leadership skills is oftentimes a strong quality of this group. And epidemiologists also must be precise and accurate in moving from observations to interviews, to analyzing data, to interpreting findings, and to making conclusions. Hence, being somewhat detail-oriented is also an important quality found among epidemiologists. Now that you have a good sense of what public health is and what epidemiologists do, I'm going to go over our amazing graduate program in applied epidemiology. We have been accredited by the Council on Education for Public Health since 2016, and we just successfully started our 8th cohort of students this semester. Every year, we graduate between 20 to 30 students who go out into the workforce, or they continue on towards professional degrees in medicine, nursing, dentistry, as well as doctoral programs. Our mission is to prepare professional public health epidemiologists with the necessary critical thinking and technological skills that will allow them to assess, implement, and evaluate programs in diverse human populations and communities. We have 15 full-time faculty and a large pool of part-time faculty who support our public health programs. Our full-time faculty to student ratio is a very low 10 graduate students for every 1 full-time faculty member. Our faculty are diverse with a wide range of research interests, ranging from sexually transmitted diseases and HIV, to adolescent health, to maternal health, to chronic diseases. And many of our faculty engage in research in these areas and have research assistantships for graduate students. Our curriculum consists of 44 units composed of 14 3-unit classes and 2 1-unit labs that are generally completed in 4 semesters of full-time study. And by full-time study, I mean the student takes between 3 to 4 classes a semester. To accommodate students that work part-time or full-time, our classes are offered during the late afternoon and evening hours, Monday through Thursday, usually after 4 p.m. This list that you see on the slide, it's not an exhaustive list of classes for our program, but just a sampling of classes that we offer in our program. And it includes a healthy selection of epidemiology, biostatistics, and research methods classes, some core public health classes in environmental and occupational health, health behavior, and health administration, additional coursework in demography and program evaluation, a 300-hour internship that is completed toward the end of the program, and we offer electives that are wide and varied with topics in infectious and chronic diseases, programming using statistical software packages like Stata, and new to this academic year is a medical geography course, which is an introduction to using geographic information systems, or GIS. This is a highly sought after skill by employers looking for students that have the skills to examine geospatial relationships or locations that may be at high risk for diseases and injuries. Now, more specifically about our admissions and applications, we do not admit students in the spring semester. We only accept applications for fall admission. All applications, letters of recommendation, transcripts, they should be sent electronically online to the respective application sites that you're going to see shortly. The department, the Health Sciences Department, will not accept any physical mail or letters that will be placed in your application folder. We have 2 application deadlines, and it is entirely up to you which deadline you want to submit your application. The priority deadline is December 1st, 2023 by 5 p.m. Pacific Standard Time. Students who submit all their applications and documentation by this deadline, they'll receive decisions in January 2024 for admission to the program. Now, our regular application deadline, which is much further along, is May 1st, 2024. And decisions on this day, if you apply for the regular decision deadline, those decisions will be made by the end of that month of May of 2024. This is a brief list of items that you should be prepared to submit for your application to CSUN and the MPH program. We require a 3 to 5 page double-spaced and signed statement of purpose written by the applicant. Please refrain from using artificial intelligence or AI to write your statements, as they will be screened for any of these tools, and if detected, your application will be automatically disqualified. You should submit any unofficial and official transcripts that help you to attain your bachelor's degree, a current resume or a curriculum vitae, or a CV as it's known. You should also have in mind 3 letters of recommendation from people who know you well from an academic and or an employment standpoint. For example, your professors or your supervisors at work would be able to provide you with good letters of recommendations. Please, at least one of your recommenders, however, should come from someone who can speak to your academic abilities to succeed in a graduate level program. So please don't ask your friends or peers to write you a recommendation letter. GRE scores, they're only necessary if your overall GPA is less than a 3.0, or if your GPA for the last 60 units of course study is less than 3.2. And the test of English as a foreign language, or TOEFL, those scores are required if your bachelor's degree is not from an accredited United States university. The steps to apply for our program requires you to complete 2 applications. One application is a general application to the university, which is CSUN, that will include all of your official transcripts, your GRE scores if necessary, and your TOEFL scores if necessary. That application is called the Cal State Apply application, and that requires a $70 non-refundable application fee. And you can begin the process at calstate.edu/apply. The other application is to the MPH program directly through Apply Web at the website as indicated on the slide. For Apply Web, you're going to upload your statement of purpose, your unofficial transcripts, your resume or CV, and the 3 letters of recommendation will be submitted by your recommenders. They will show up in the Apply Web account as well. There is also a $30 non-refundable application fee associated with Apply Web. All of these specific application steps that I just mentioned, they can be found at our CSUN MPH website under How to Apply. So how does the admissions committee decide who to accept to the program? We adopt a holistic admissions process to admit students to our program, where the admissions committee as a group look at all the parts of your application to see factors that make you an excellent candidate for our program. So we look beyond your GPA, we look beyond your test scores, and I would really emphasize any public health or related work experience or volunteer experience that you have that shows the qualities and skills that would make you a successful student in our field. If you have any experiences with diverse communities and cultures, or if you have any personal life experiences that can tell us the story of you and why you want to pursue an MPH in applied epidemiology and how you would benefit to be in our program, please let us know in your personal statement and your resume. So now let's get into some of the questions that students typically ask of our program. Many of these questions are also found at our csun.edu/MPH website. Our program, just to tout our program a bit, I think is amazing. It's fantastic. I may be a little bit biased in saying that, but I truly believe it is one of the best graduate epidemiology programs in the nation. Recently, as you may or may not know, CSUN was ranked 2nd behind Berkeley as one of the best public universities in California by the Wall Street Journal, and 12th best public university in the nation. And much of it is due to a heavy investment in student success and upskilling initiatives. Our professional courses and programs help students advance in their careers while offering the best value among California universities. Hence, CSUN is an attractive place to get a quality education at an affordable price. Our class schedules, as I mentioned earlier, they're designed to meet the needs of working professionals who cannot afford to take time during the day to attend classes. So we arrange our classes so that all of them take place after 4 p.m. And students, generally speaking, only need to come to campus 2 times a week. Our faculty are dedicated to our students and to their success in and outside of the program. MPH students are often telling me how accessible, how supportive, how approachable our faculty are in the program. And much of the positive experiences can be attributed to our smaller class sizes that number no more than 20 students to a class, the opportunities to conduct epidemiologic research with our faculty, and that includes some teaching opportunities to the undergraduate students. Also, our strong network of community partners that offer internships, which can lead to possible employment following graduation. All of this makes CSUN's program very unique and probably one of the best value programs that we have in the nation. How long does it take to complete the MPH degree? As a full-time student, meaning 3 to 4 classes per semester, it takes between 2 to 2.5 years to complete the requirements of the MPH degree. Now, if you plan to go part-time and take 1 to 2 classes per semester, then it will probably take a little longer, between 3 to 4 years. What is the cost of tuition and fees? The numbers you see on the slide, these are for the academic year 2023-2024, but we do not anticipate any significant, if any, increase in fees for the 2024-2025 academic year. For full-time students, the cost is $42.62 per semester, and for part-time students, the cost is $27.56 per semester. This is an exceptional value for the education. If you are a non-California resident, you should add $396 per unit to the tuition and fees cost. Can I transfer graduate level public health course units from another accredited institution from CSUN? Yes, you can. And any graduate level courses that are equivalent to our MPH courses, they can be used to fulfill the degree requirements in our program. However, no more than 9 units total, which is about 3 classes, can be transferred to CSUN. When are classes offered? As I mentioned earlier, classes are scheduled Monday through Thursday from 4 o'clock to 10 p.m. And usually our required courses, they are offered from 4 to 7, and our elective courses are offered immediately following from 7 to 10. Students generally come to campus for classes twice a week, although there are some times when electives occur on different days, and so they may have to come in a third time during the week. Is the MPH in Applied Epidemiology recognized as a STEM major? If I had a nickel for every time a student asked me this question, I would be a very wealthy person. This is probably the most asked question, especially among international students. The answer is a resounding yes. It is a STEM major. And the reason why students ask this question is because for international students, if they graduate from a STEM major in the United States, they are allowed to be employed in the United States for 36 months after graduation. Whereas if they are graduating with a non-STEM major, they are only allowed 12 months of stay in the US for employment purposes. So an additional 2 years in employment in the United States is definitely a benefit to graduating with a STEM major. I am an international student and I have questions or need help with my application. Many times I do not have the answers for international student related questions, and so I will refer them to the CSUN International Admissions Office. So please do contact them at the email that's listed there, intladm@csun.edu, or you can call them at the number there. They also have a website that you can visit that's listed on the link at the bottom of the slide there. When will I expect to hear a decision after submitting my complete application materials? International students should submit their applications as early as possible, even after December 1st. If they wanted to submit it, anytime during December, that's fine. The reason is the admissions committee has given earlier decisions for international students, because we know that once you're admitted, international students have to apply for travel visas to study in the United States. And that means they'll need to make appointments with the embassies to obtain these visas. I had 2 international students earlier this summer who were denied visas because they were too late in applying for them. So my recommendation is for all students to try to submit your applications as early as possible. If you can't make the December 1st deadline, that's okay. Don't wait until May 1st to submit your application. Try to get them in as early as possible, because the admissions committee might be reviewing them even earlier than May 1st. I am interested in the Masters of Public Health for Community Health Education. Are there any information sessions for these programs? Yes, there are information sessions for these programs upcoming on November 7th. We have the MPH CHE, the on-campus option, and those information sessions occur at noon, at 12 p.m., and at 7 o'clock p.m. on Zoom. The MPH CHE option, that is distance learning online based, that information session, the next one will be December 6th at 12 o'clock noon on Zoom, and these are all Pacific Standard Time. If you need more information and how to get on the Zoom link for those, you can always access the MPH website online. And if there are any additional questions, please do contact the CSUN MPH website. That's you can use the QR code that's on the right of the slide there, or you can just go directly to csun.edu/MPH. And if you look under prospective students, there's also an MPH application checklist, the frequently asked questions. I didn't go over all of them, just some of them now. If you're an international student, you can contact the International Admissions Office for more assistance, or you can always email me at lawrence.chu@csun.edu for more information about the program. Or if you have any questions about the admissions process or the applications, feel free to email me with any of your questions that you might have. Okay. So now I'm going to go ahead and open it up to any questions and if you want to raise your hand and I'll call on you, and I'll be able to answer any questions you might have about the program. Yes, Jonathan?
The GRE test, how do I apply for it?
How do you apply for the GRE test? I believe it is given by the College Board. So if you go to the College Board, you can apply for the GRE exam, and it's offered multiple times throughout the school year. I believe probably about between 5 to 8 times during the school year it is offered, and you just sign up for it, pay the fee to take the exam, and you would take the exam at the site that's indicated.
Okay, thank you. And I also have another question if possible.
Yes, go ahead, Jonathan.
Since you're the coordinator of the program, are you allowed to give out recommendation letters or no?
Yeah, that's a great question. Thank you for asking that. Actually, because I am the graduate coordinator for the Applied Epidemiology program, I cannot write recommendation letters because it would be a conflict of interest for me to write a recommendation letter to the program that I'm admitting students to. But you can ask certainly some of the other professors, the other faculty that are in the program to give you recommendation letters for, or even any professors in the public health program. They should be able to furnish recommendations letters for you.
Thank you.
Okay, good. You're welcome. Yes. I'm not sure how to pronounce this. Is it Kayla or?
It's Shayla.
Shayla. Okay.
Hi, I have a couple questions. So my first question is, you said the GPA has to be a 3.0. It has to be 3.0 on the dot or over a 3.0?
If it's 3.0 on the dot, you do not need to take the GRE.
Okay.
If it's less than a 3.0, then yes, you should take the GRE.
Okay, great. And then your personal recommendation when it comes to the letters of recommendation, do you suggest that for example, where we work, our bosses, would you say that if we get all letters of recommendations from our previous work history versus administration or staff from our schools, what would you say holds more weight in your opinion?
Yeah, good question. Keep in mind that at least one of your letters of recommendation should come from someone who knows you well from an academic perspective. So a professor that you had for a class, a teacher, anything of that sort. As for supervisors, whether they are outside of CSUN or inside CSUN, I think it doesn't really matter. I think you should pursue letters of recommendation from people that you know will write you a good one, or that know you very well and will write you a good one. I think that's probably the most important factor when it comes to the recommendation letter, so that they can, give you a glowing review, if you will.
Okay, thank you.
You're welcome, Jayla. Elena.
Hi,
Hello.
Dr. Chu. I wanted to ask about the deadline. So I wanted to apply to the second deadline in May. However, how early can I apply for that? So let's say, like, can I apply for it in December, but not be the priority
Yes.
application?
Yes, absolutely. So, if you are rushing to meet the December 1st deadline and you feel like you won't be able to meet it, go ahead and apply anytime during December or January. Don't wait until May to put all your, documentation in. Okay. Whenever you feel comfortable enough to submit all your documentation, go ahead and do it, and don't wait till May. And again, the reason is because the admissions committee may be rolling in terms of looking at applications before May 1st and making decisions before May 1st, in which case you'll get an earlier decision than end of May.
Okay, I see. And then I also had another question. I talked to you in class about the internships that we have to do in the spring. Would you recommend that I wait until I complete that, or can I just write on my resume that it's in progress?
You can say on your resume it's in progress, but if you were to get, for example, a recommendation letter from your internship preceptor, I would wait until you are more familiar. And if you wanted to request a letter from him or her, I think that would be better, because you may want to write about it in your statement of purpose. I don't know.
Right.
But you can say in progress on your resume if you want.
Okay, thank you so much.
All right, you're very welcome. Krish, yes, hello.
Hi, Dr. Chu. I actually have got two questions. So actually, this is for my sister, and she's quite interested to apply for this course in the next fall, 2024.
Okay.
And she actually has two questions basically. So the first one is so she actually gave her IELTS. Will that be accepted over TOEFL? That's
Good question. That is a question I think I will defer to the International Admissions Office. If you could contact them. I'm not sure whether they will accept IELTS over TOEFL or not. I have heard that they have before, but I am not certain whether that is in fact the case.
okay. Sounds good.
Yeah.
And then for she's much more interested in the STEM program. I know, like, you confirmed that it's a STEM program now, but can you confirm that if that STEM program is for the next fall 2024, so that she can apply for it?
Yes, yes. Most frequently asked question, is this program a STEM program? Yes, the Applied Epidemiology, MPH and Applied Epidemiology is a STEM program. Now, the MPH in Community Health Education is not a STEM program. So just to make that distinction, I want you to know that the Applied Epidemiology MPH is a STEM program as listed by the CIP code.
All right, and that's for fall 2024, right?
Yes, that's correct. So that's for anyone during fall 2024 and beyond.
All right, sounds good. And then also, like, I had a question regarding because I actually missed out on the tuition fees. Is there a way you can actually show me the tuition fees again, please?
Yes, let me see if
the
I can get back to that slide again. Here are do you see it on your screen, the tuition and fees?
Yeah, I do. Yeah, I do.
So if you want
Awesome.
to take a screenshot of that to save on your computer, you can do so.
Yeah, I just did that. Yeah.
And then let me give you one more slide. And this is the International Admissions Office, because I know you had the question about the IELTS. This is the contact information.
Okay, sounds good.
Okay.
And how I also actually wanted to ask about if she has to apply for any financial aid or scholarship, how is the process for that?
Yeah, great question. And I apologize, I don't have a slide on financial aid, but we have a financial aid office at CSUN that manages and handles all that. We do not, as a program, handle any of the financial aid. We don't have scholarships, but we do have research assistantships and TAships available. However, most of the time, first-year students do not apply for a research assistantship or a TA-ship. They generally wait until the second year before applying for those. But if you have information or if you need information about financial aid and scholarships university-wide, I would encourage you to contact the CSUN Financial Aid Office. And if you do a quick search online for CSUN Financial Aid, you should be able to reach their website for that.
Okay, sounds good. Thank you so much.
Thank you,
That's
Krish.
pretty much it from my side.
All right,
Thank
thank
you.
you for the questions. Chayla, welcome back. Yes.
Yeah, sorry, I have another question. Do you know the ratio or the statistics regarding like admission? So like for every however many students apply, do you know like what the acceptance rate is for the program?
Yeah, great question. I've only been in this position for 1 year, so I only know based upon last year's entering class. I would say that the admissions rate is somewhere probably between 25 and 30%. I would say
Okay,
between 25 and 30%. Yeah.
okay, thank you.
All right, you're welcome. Serban, yes, you have your hand up.
Hi. So when we're applying to the Cal State website, I saw that it mentioned we need to submit unofficial transcripts.
For Cal State Apply or for the MPH applications?
I believe it's for the Cal State Apply.
Huh. Okay, that's probably true, but I think eventually you're going to have to submit official transcripts to Cal State Apply. I know for Apply Web, which is the MPH website, you do not need official transcripts, but you just need the unofficial ones. But for Cal State Apply, eventually they're going to request the official transcripts. And
Okay.
your application won't be complete until you submit the official transcripts. So even if they do ask for unofficial ones, you will have to submit official ones eventually.
Okay. And would that have to be from every institution we went to, or
It would just have to be from the institutions where you took classes that went towards your bachelor's degree.
Okay.
Yeah.
Mhm. All right. Thank you.
Okay, you're very welcome. Chris, do you have another question or is your hand still up?
Sorry, my hand is up for some
Okay,
reason.
no
I don't know.
worries, no worries. Are there any other further questions? Yes, Malika, hello. Hello.
Hello, Dr. Chu. Thank you so much for the presentation and the information you have provided. I actually emailed you. I already applied. Just a question. I was wondering if there is any chance to kind of like edit something on my application after submitting it, or when it's submitted, it's kind of close to any editing.
Right. So you submit edit something. Sorry, I hear an echo in the background.
Yeah, sorry if like can you hear me better now?
I can hear you fine.
Okay, sorry, I'm in my I was wondering if by any chance if there is any by any chance I can edit something on my resume and resubmit it again.
Yes, I think you can go ahead and
Yes,
edit
I think you
something
can go
resume
ahead and edit
and
something
resubmit it.
resume.
I think it should be fine.
Okay, all right, thank you. Thank you so much.
You're welcome. Any other questions? Okay. All right. Well, I thank you for joining me tonight, and I hope everyone has a very lovely and safe weekend. And if you have any further questions, please email me. My email address, as you'll see right here, lawrence.chu@csun.edu. Good luck with your applications, and I wish you well. Have a good night.
Thank you so much, Dr. Chu.
Thank you, Chayla.
Thank you, Dr. Chu.
Thank you.
Thank you.
Thank you, guys.